We think about going to a hypnotist and someone putting you in a trance, and then you tell the hypnotist what your problem is, and they listen. Then they come up with some strategy, and then they try and help you out of it. I see it the other way around. I think we're already walking around in trance, albeit negative, limiting trance states. So really, if I wanted to, and I do in some way, just take that person out of that negative trance they've been in for 20 years. The trance where they say, I can't quit smoking, I can't lose weight. Because it is only a belief. We know that under certain circumstances, of course they're going to quit smoking, of course they'll lose weight. So most of the people that come in have these limiting beliefs and limiting trances. And I think it's the job of all therapists, no matter what kind of field of therapy you're doing. Ultimately, what you're going to do is change a belief. They come in with one limiting belief or 2 or 100 limiting beliefs. And at some point during your time together, you're going to undermine that belief. Let's take smoking for a quick example. There are 3 beliefs that hold people to smoking. One is that they can't quit. One is that they're addicted. And 3 is that they're getting something from it. Now, if you leave that client with any of those beliefs intact, they're going to continue to smoke. And I teach people how to undermine all 3 of those beliefs, because they can all be undermined. You can help someone out of pain, long-term chronic pain, in less than 5 minutes with the arrow technique, which sounds a big statement, but it's absolutely true. And that product's gone all around the world now. We've been teaching it for years, and now it's gone out there. I want everyone to use it. I want mums to use it, dads to use it. Now, the only question with pain is that pain of any use to you anymore? But if it's long-term chronic pain that's only giving painkillers for, then your brain has somehow enables you to let it go. I think it's just giving yourself permission to ignore it. I can't think of any other description of why that works, but it's a super powerful tool. I know how busy doctors are. They have a 5 or 10 minute window to see a patient. And if that doctor's giving that client, that patient, as much painkillers as they can give them, and it's not touching the pain anymore, my question would be, why would you not just say, look, just close your eyes for a moment, let's run this. And within 5 minutes, run the arrow technique. As I always say with things like pain or any kind of healing process, and I don't consider myself to be a healer at all, but I believe we all have the ability to heal ourselves. With any of those things, what I say is, look, I'm not going to give you any pills or potions. This is only words, it's only imagination. What's the worst thing that can happen? The worst thing that can happen, they can still have the pain. But if we do this right, and it's very simple to do, the chance of that pain is going to be drastically reduced or eliminated if it's long-term chronic pain. Hypnosis is a phenomenal tool, and it has got a bad rep. The general public don't have that opinion anymore. Now, people maybe years ago say, you're not going to walk like a chicken. No one says that to me anymore, because they know how powerful a tool it is. There's been enough evidence out there of people overcoming problems with hypnosis for people to go, well, let's try this. As I said earlier, it's words. It's not pills. It's not potions. It's not like, try this pill, it might work. This is just words and imagination. And my attitude is, what's the worst thing that can happen? The worst thing that can happen is nothing happens. But as I always say, what if we have this hour together, and what if after that, the need for a cigarette's gone, the need for cocaine, the need for that drug's gone? What if that pain's gone? What if? And that what if opens up a world of expectation.